Carpal tunnel is a very common problem. If you work in an office or do repetitive motion with your hands or wrists in particular, it's possible that over the course of your life you may develop carpal tunnel syndrome. In fact, it's common enough in society, chances are you probably know somebody who at some point has been impacted by carpal tunnel syndrome. In carpal tunnel syndrome, the nerves in the wrist, where they pass through underneath the bones and over a strap type ligament that's in this part of the wrist, where these nerves pass through to go to the hand, the tunnel becomes narrow. And when that tunnel becomes narrow, the nerve doesn't have the space that it needs, and so the tissues start to press on the nerve, which causes the nerve to hurt. Typically, for a diagnosis, you typically do need to see a physician for this. In particular, because one, you want to make sure that it is carpal tunnel syndrome. There's many other things that can cause pain to radiate from the wrist down to the hand, and there's also a variety of things that can cause the hand to weaken. And certainly, because of how much we use our hands, we want to make sure that we have an evaluation by a physician to make sure that we can restore the function of our hands and make sure that we have healthy functioning hands. In my office, my approach to treating carpal tunnel syndrome is first to look at the structural cause in the patient. As I mentioned, the wrist is kind of a dome. The bottom of the dome has ligaments, and all through the opening run all of these blood vessels and nerves that go down to the hand. So the first thing that I like to do is to make sure that we have a stable wrist and that we do everything that we can to make sure that that tunnel is as open as it can be. Oftentimes this involves osteopathic manipulation. For some patients, prolotherapy may be beneficial to help strengthen the wrist so that the wrist bones are able to maintain that proper arch. In other cases, Chinese medicine, herbal medicine, or acupuncture can oftentimes be very effective for treating carpal tunnel syndrome. Typically, in my office, what I like to do is start basic treatments with the patient, and within about a month I like to start seeing improvement. But I watch carpal tunnel patients very, very closely, because what's key in the treatment is we want to make sure that nerve function is intact enough that we're not losing muscle function. Because if we start to see decay in the hand, if we start to see we're losing strength, if we see signs that further nerve compression is occurring, that oftentimes is a good indicator that we need to look at either a steroid injection into the carpal tunnel or surgery. So it's important that you have a physician involved in your care, but typically with some of these treatments we're able to start to see improvement within about 4 weeks, usually full resolution within 2 to 3 months, if not sooner.